In this video, I'm going to show you how the newest over-the-counter earwax removal system, Earwax MD, works. Coming up. Hi guys, I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Anthem, Arizona. And on this channel, I cover a bunch of hearing-related information, so if you're into that, consider hitting the subscribe button. One of the most common things I see in my clinic is patients with excessive earwax buildup. And as it turns out, excessive earwax buildup is actually extremely common. Now, a little bit of earwax is good. It actually coats and protects your ear canal. But when too much of it builds up without working its way out of your ears, it can lead to problems like hearing loss or ear fullness. It can even make your ears feel itchy, and it can cause tinnitus, which is otherwise known as that ringing or buzzing inside of your ears. Now, I know what you're thinking. If I had some earwax in my ears, I'll just go for a Q-tip. Wrong. Q-tips are actually really dangerous to use. Not only can you rupture your eardrum, but you can actually push earwax further inside of your ear, and then when it starts to dry out, you can actually have an impaction, which is much more difficult to get out of your ear than if you didn't use a Q-tip at all. So you might be getting a little bit of earwax out when you use a Q-tip, but at the end of the day, you're probably causing more harm than good. Now, when you have impacted earwax, it actually creates an even bigger problem. So when you come into my clinic with impacted earwax, I usually have to send you home for a week using earwax softeners in order for you to come back to my clinic so I can suck out what's remaining. Because of this, I'm always evaluating new products that come to market, and this time I stumbled across Earwax MD. What Earwax MD claims to do is actually soften earwax quicker or even dissolve earwax to make it easier to remove, whether you do it at home or whether a hearing care professional does it in their clinic. So what's the science behind Earwax MD? Well, the first thing is that it uses sodium and potassium bicarbonates. And what these do is they interact with the long-chain fatty acids found in cerumen, otherwise known as earwax. And what it does is it turns them into more hydrophilic rather than hydrophobic molecules, which means that they absorb water easier. The second main ingredient is glycolic acid. What glycolic acid does is it actually interacts with skin cells, because you have to remember, earwax isn't just wax, it's wax combined with dead skin and with hair that's inside of your ear canal. And so if you can actually loosen that dead skin, it will start to break apart the earwax. The third main ingredient is glycerin. What this does is it drives water into skin cells, creating kind of like a hyperhydrating effect. Now, when you combine all three of these ingredients together, you basically have a perfect recipe for softening your earwax. Now, this all sounds great, but before I recommend anything to any of my patients, I need to make sure that it works. So I went ahead and asked several patients to come into my clinic so I can see how well the product works on them. In total, I had 5 patients come into my clinic so I could see if this product actually does a better job at softening and removing earwax. And in this video, I'm going to show you the 2 most complex cases. Let me introduce you to Heather.
I'm Heather Nguyen. I'm a retired nurse practitioner, and now I have an alternative healing practice called Arizona Healing Alternatives. Probably started when I was about 30. And the wax just builds up, and then it gets to a point actually where I can't hear.
All right, let's take a look at Heather's left ear. Warning, this might be a little gross. So here I am doing visual otoscopy, and what you're seeing there, that dark substance is her earwax. And let's show you the right ear. Again, as we go into the ear canal, that darker substance right there is the earwax that is in her ear, quite a bit of it. All right, so now we're gonna put in the Earwax MD. So here you see me putting the Earwax MD solution inside of Heather's ear to fill up the ear canal. And after 10 minutes...
So then it looks like it is. Oh my.
Hang on to that.
Yeah, no, should we frame that? That's disgusting. Should we frame it?
And there you go. That is the size of the plug that we were able to pull out of Heather's ear using Earwax MD. So let's take a look at her ears after Earwax MD. There you go, nice and clear. That is her big, beautiful eardrum right there, and my light shining off of it, reflecting off of it nicely. And let's take a look at her right ear after Earwax MD. A little bit of residual wax around the outer portion of the ear canal, but ultimately a great looking eardrum in her right ear. So we'll do a side-by-side comparison of both the left ear, and there you have on the left is before the removal, on the right is after. And for the right ear, on the left is before, and on the right is the after.
They feel wonderful, truly. No, seriously, it was uncomfortable before, so thank you. I feel fantastic.
Excellent.
It just felt like regular drops, and it felt, the interesting part about it was I could almost feel it moving things around. I could feel on the right side, it felt like it was going in a little bit deeper than on the left. So I could feel that happening. Very comfortable sensation though. Oh, it's relief when it came out, and so easy, because the thing that's so frustrating for me is when you're doing drops over the counter and you're doing this at home, you have to do this for several days before you even get any relief. This is wonderful to be able to just do the drops and then get it out.
Earwax MD was a resounding success for Heather. It really left your earwax so soft that it was super easy for me to pull it out of her ear. And you saw the huge clump that came out of her right ear. All right, so Heather was a success. Let's take a look at Linda.
My name is Linda Larkin, and I'm from Anthem, Arizona. It started many years ago. I honestly don't know how long ago. All of a sudden, out of the clear blue sky, I started to get this itching and this feeling something was going on in my ears, like annoying. Nothing, not painful, it's just annoying. And it felt like when I would put my finger in my ear, it definitely was wax. I did air candling, and I did some drops, natural drops, and I guess that's all. I don't do very much treatments. I'm not I don't go to medical doctors, so.
All right, let's take a look at Linda's left ear. As we go in, she has a really dark black plug that is completely blocking off her ear canal on this side. Her other side did have a little bit of earwax, but this was the ear that we were really focused on trying to get that plug out of. Here I am administering the Earwax MD. After 40 minutes and 4 removal attempts later, there we go. We got it.
Really? Oh my God, that's huge. I hear so much better now.
Yeah, I bet you do.
Yeah, like I noticed it even when he was in there. I could tell something was better because I could hear.
I bet you your ear will not itch as much.
I'm sure it won't. The wax is what's making it itch, of course. It's been sitting in there probably for years.
All right, let's take a look at Linda's left ear after Earwax MD. As I do the visual otoscopy to look inside of her ear, there we can see the eardrum in her left ear, something that we could definitely not see before because it was completely blocked off by earwax. And here we have the side-by-side comparison of before using Earwax MD in the left ear and after using Earwax MD. Definitely a huge difference.
Much relieving. I feel my hearing is definitely more acute, and I don't feel that itching or all those symptoms that I had. It feels clean.
Now, Linda's earwax proved to be a tall order for Earwax MD. It actually took us 4 10-minute applications of Earwax MD to really soften things up enough to at least around the edge of the plug that was inside of her ear for us to be able to get that plug of earwax out. And you saw, of course, on camera how big that plug was, and that was adhered to her ear canal wall. So it was literally stuck against her skin, and so it really took us all 4 of those applications of us trying to apply the Earwax MD, squirt it out with the bulb syringe, and then really suctioning it out with my suction device. And only on the 4th attempt that we did that were we actually able to get it out. She was pretty exhausted by the end of that, as you can imagine, and for her, if she was using that at home, I'm not really sure it would work that quickly for her, and I think she was going to end up needing professional assistance with that earwax regardless. All right, so I'm going to recap real quick. For the 5 patients that I had, every single one of the patients was able to leave my office within that hour session with squeaky clean ear canals. And I'm not entirely sure that it could have been something that I could have done without using Earwax MD. Now, I didn't compare it directly with other typical over-the-counter type solutions, but what I do know for sure is that when you use Earwax MD, it softens that earwax and it definitely makes it easier to pull out. All right, so let's talk about the 4 things that I really like about Earwax MD. And the first one is it works really quickly. One of the biggest problems that I have is that when someone comes in with an earwax impaction, I need to send them home for an entire week to use a typical peroxide over-the-counter solution to soften that up enough so they can come back into my office so I can suction it out of their ear. So if I can use Earwax MD at the office and within a 30 to 45 minute time period, completely clean out someone's ears, even if they're impacted, that is a huge bonus for me in the clinic. And it just kind of goes to show that if you're trying to remove earwax at home, it's something that absolutely works and works quick. The second thing that I like about it is that it doesn't have some of the same nasty ingredients that you would find in other over-the-counter earwax softeners. Some of those ingredients that you read on these other leading brands of earwax softeners aren't necessarily the healthiest products in the world. So when you're looking for a product, you want it to work. And so if those other products work, that's great. But if you can find a product that works that doesn't have all of that junk in it, I think that's even better. The third thing that I like about it is that you don't need to go into your hearing care professional in order to use it. You can get it over the counter or online at stores like Amazon. And because of that, you can actually either prep at home by using it before going into an appointment to have earwax removed, or you can just use it at home, and if you use it consistently enough, you'll be able to make sure that you keep your earwax at bay. And number 4 is that it completely removed impacted earwax out of my patient's ears in only 40 minutes. Now, I know that 40 minutes seems like a lot of time, but typically what would happen in that scenario is that you would go home for an entire week using drops multiple times a day for 15 minutes at a time, only to come back a week later after really having a bunch of gunk in your ears for me to suction it out at that point. You could do all of that in 40 minutes rather than multiple applications every day for an entire week. And with the good always comes the bad. That bulb syringe, it's bad. I don't like it. Now, I think it's a necessity. So if you are using Earwax MD, you want to have a way to kind of wash that solution out of your ear, and using the bulb syringe is a great way to do that, but do not expect it to just blast all of that earwax outside of your ear. You may need to use something a little bit more substantial, even if it's just a bigger bulb syringe, but really one of those spray bottles that is specifically designed to remove earwax, or even one of those actual handheld irrigators. Overall, it appears that Earwax MD does in fact work. In fact, in my clinic, I am going to replace the old brand that I used to use with Earwax MD. If nothing else, even if it works exactly the same, I like the ingredients inside of Earwax MD better than those other over-the-counter products that I've been recommending before. One thing I have to say is that it is impossible to know for sure if you have earwax and how much of that earwax that you have in your ears. If you are having the sensation of being plugged up, it doesn't necessarily mean that it's earwax causing it. So you should always have it checked out by a medical professional. And I also have to warn you that if you experience discomfort using this product, it is not something that you should continue to use. If you have a puncture or a hole inside of your eardrum, you should absolutely not shoot anything inside of your ears, whether it's Earwax MD or water or anything else. And the third warning is do not flush your ear out with cold water. It will make you dizzy or even feel nauseous. Now, if you want to order some Earwax MD for yourself, I will have a link in the description below that you can click on to go to Amazon to buy the exact product that I am talking about. I will also have a link in the description below so you can get a better irrigating tool than that bulb syringe that they have in the box. That's it for this video. If you have any questions, please leave them in the comment section below. If you liked the video, please share it. And if you want to see more videos just like this one, go ahead and hit that subscribe button. I'll see you next time.